Welcome everyone. Thank you for joining Continuous Learning with Bioguard. It is my pleasure to introduce our webinar speaker, Dr. Chen Xilin. Dr. Lin got her DVN degree from National Taiwan University and her PhD from the College of Biological Science and Technology, National Jiao Tong University. She's a professor in the Department of Veterinary Medicine and Director of Zoonosis Research Center at National Taiwan University. In addition, she is a former director of the Animal Disease Diagnostic Center at the National Taiwan University. Her specialties include veterinary clinical microbiology, clinical pathology, and animal cancer biology. Liver function testing in dogs and cats is a crucial clinical assay to evaluate the hepatic health status of animals. The liver plays multiple essential roles in the physiological process of dogs and cats. In this lecture, Dr. Lin will explore biochemical blood markers, blood coagulation index, blood and BUN and creatinine, and also blood glucose level. Through this test, vets can formulate appropriate treatment plans to guarantee dogs and cats' long-term health and well-being. We are glad to have Dr. Lin as the speaker for this webinar. Without further ado, let's welcome Dr. Lin.
Thank you for the introduction from Dr. Luo, and thank you for all the audience joining us tonight. So good evening, everyone, ladies and gentlemen. It's my honor to be here and to share the knowledge with all of you about especially focusing on liver functions. So today we're gonna introduce the liver function test, focusing on dogs and cats. So we'll start from briefly review about the anatomy of liver, and then we will move on to the what the routine test we will do to probe liver functions. And then we will also introduce the common liver situations, and during each situation, what kind of the markers will be changed and can be investigated for the disease diagnosis. So let's start for now. And I am Chen Xilin. So I think from the introduction from Dr. Lo, and everyone have already known me a little. So I will move on. Okay. So I'm currently the professor in National Taiwan University Department of Veterinary Medicine, and I'm in charge of Zoonosis Research Center as well as the cancer study center. So basically, my expertise focusing on immunology, microbiology, as well as cancer biology. So I welcome all kinds of questions. If you have, you can contact me with the email. So when we talk about liver, we just start from the anatomy. So it's the back side of the liver, and there is the there are some significant points that we need to notice. The first one is when we look at the backside of the liver, we need to know that the major blood infusion into liver actually come from first is hepatic artery, and second one is the portal vein, actually is the portal vein. So hepatic artery and the portal vein actually provide the major blood supply to the liver, and we know liver is the largest organ within the abdomen, so it needs a lot of blood supplied, as well as the blood and the blood coming from gastrointestinal tracts. They will go into liver through portal vein. So that is why this part of the giant, actually major blood supply coming from portal vein, and the blood within portal vein actually contains all the nutrients, all the important nutrients observed through gastrointestinal tract, and but as well as some pathogens also, because the GI tract actually it's the kind of the interface that not only take up the nutrient, but also they will take up some pathogen that is not good to the animal or humans. So we are talking about the basic blood supply coming from hepatic artery and portal vein, and all this blood, if they then they will leave liver, they will through this inferior vena cava, this actually hepatic vein, and then going to the inferior vena cava. So this is the blood supply of liver. Two systems to inject the blood into liver, and the hepatic vein and then inferior vena cava, they will help to move this blood to the help the blood to move into the systemic circulation. So this is the blood system of liver. And another system we need to mention is about the bile duct system. So we can see the gallbladder here, and gallbladder actually is the place to store for bile storage, because bile is produced by liver, by hepatocytes. So this bile, when they produced from hepatocytes, then they will be stored in the gallbladder. So there will be the bile duct to transport the bile and into the gallbladder. So all these systems are important, since in liver diseases, we not only need to focus on the liver parenchyma, I mean hepatocyte portion. Another system, bile duct system, is also the important cause to result in disease problems. And sometimes the problem occur in parenchyma and will also influence the bile duct system, and so as the controversial way. Okay, so this is the if we try to cut the liver, and we can see all the blood vessel system of liver, and we understand that this important portal vein, hepatic artery, and the hepatic vein, they will start from the main blood vessel and divide to the smaller ones, and to infiltrate into all the liver parenchyma. So if we just just to look at the single unit of the liver, we can find this is what we just mentioned about. Okay, this is the divide of hepatic vein, and this is the divide of the branch of hepatic portal vein, and this is the branch of hepatic artery. So, this is then we can understand that this hepatic artery branch and the portal vein branch, they are outside of the liver, the small unit of the liver, and they provide the blood supply from outside into the central place. That is the branch of hepatic vein. So they provide the nutrients, they provide the oxygen through hepatic artery or through hepatic portal vein, and then all the blood will be collected into the branch of hepatic vein. So this is the blood system. Now this is the bile duct system. As I mentioned before, the bile actually is produced by these kinds of so-called hepatocytes. This is the parenchymal part of the liver. So this hepatocyte will produce bile, and bile then will be drawn into the bile canal, or drawn into the bile canal. So you can see the direction. Actually, this bile, it will be transported into the bile duct, and then they will collect together to the bile, to the gallbladder. So it's this 3D view of all this, the single units of the bile, of the liver, sorry. So what we call about the parenchymal cell actually is they are consisted of mainly hepatocytes. So this parenchymal cell or these hepatocytes are they consisted of 60% of the liver, 60% of the liver. This is the major part of the liver, and there is another kind of cells that's so-called non-parenchymal cells. This be the rest part, and these non-parenchymal cells will consisted of the following cells. First one is Kupffer cell. Kupffer cell actually is macrophage. Macrophages live within the liver. That's what we call the Kupffer cells. So from this point of view, we understand that liver also played an important role in immunology. Since we know that through portal vein, the GI, the nutrient, the blood from GI tract will enter into liver. So they need some kind of the immune system to help to defend the possible pathogen infection or the possible foreign materials not related to the host. So immune system is also part within the liver. So such as Kupffer cell, it is the major immune cell within liver. So it consists of this so many big population within the liver, and we can also see large granular lymphocytes. So again, it's immune cells. And also kind of ethel cells and the endothelial cells. This is the cells consisted this basic unit of blood vessels. So this is the blood supply we just mentioned, and just as I said, that actually around 80% of the total blood flow into the liver actually is from portal vein system. And this portal vein system actually delivers substances absorbed from the GI tract. And another part is some hormone from pancreas. And the function of this hormone basically is to promote to maintain and promote the integrate or enable the hepatocyte growth, something, and there as well as hepatic artery basically play the role for providing nutrition and oxygen. So actually, because we can understand that this all the blood flow in liver, finally they will join to the hepatic vein and go to the central vein. So this is the normal liver function actually can be altered. Sometimes they can be altered not by the pathogenic condition of liver, but secondary to other diseases. So here is the 4 major reasons that will result in abnormal findings in liver functions. So first one is cardiovascular insufficiency. So if this case has some cardio problems, and they will then the blood flow of the liver will also be influenced due to they cannot go back to the central to the systemic circulation system. So cardiovascular patient, especially CV cardiovascular insufficiency patients, you can commonly find the abnormal liver functions, and also the patient suffering from anemia and the portosystemic shunts, and it's basically in animals it will be the heterogenetic, the genetic problems that cause some blood shunts. So made this blood that made abnormal vessel development. So if the case is suffer from portosystemic shunt, it means this blood vessel, such as portal vein, it cannot smoothly to transport the blood enter the liver, but it bypass the liver, something like this. This is the common condition for the portosystemic shunt. If this case happens, and it will cause the liver problems, and later we will introduce. And also some cases, if the dog's case or cats, they suffer from the infected by bacteria coming from GI system or their byproducts, they will at the first stage, of course, the liver will fight through their immune cells. But if this immune cell fails to fight to destroy these pathogens, then these pathogens will also infect and damage livers. So the first issue I want to introduce is about the portosystemic shunts, so-called PSS in short. And this kind of shunt actually is the bypass of the blood vessel of the liver. So it's bypass of the liver by the body's circulatory system. So it can be either there is 2 reasons to cause PSS. One is congenital, the other one is acquired condition. And if this case is suffer from congenital PSS, actually it's basically it's a hereditary condition. It's genetic problems, and actually is the common reason found in dogs and cats. And there is second reason is acquired PSS. And acquired PSS will secondary to liver disease, such as cirrhosis or severe liver fibrosis. And once if the liver, there are too many connective tissue deficits within the liver, this is so-called liver fibrosis, or to the most severe condition irreversible condition, that is so-called cirrhosis. If cirrhosis or severe fibrosis occurs, they will cause the hypertension of the liver, and that because the parenchymal part has disappeared, is replaced by the connective tissue. So the blood from portal vein, they cannot enter the liver because there is no way, because they are this blood circulation, they will be blocked by all the connective tissue, so they cannot enter the liver anymore. This is so-called portal hypertension, because all the blood will stuck in the portal vein, for the road enter the liver are blocked. So in this situation, there will be the new vessel development occurred. So this new angiogenesis, and try to bypass liver and to help to transport this blood to bring them back into the systemic circulation. So there's two kinds of PSS. One kind is extrahepatic and another kind is intrahepatic. So, okay, this is so-called intrahepatic PSS. You can find the stent. This is the new blood vessel, and this blood vessel has crows. That has crows. They form the new tunnel to help the blood from portal vein and directly enter to the hepatic vein. So it's a kind of an abnormal blood vessel development situation. But this is basically they can be congenital or they can be acquired. While acquired case is called PSS in human. Most of the cases are acquired one, but in dogs and cats, actually it's congenital ones is the common situation. So we can find that this excuse me. Okay, so we just talk about, so what is the component? What is the component of the we're reading the portal blood? And basically in portal blood there are some major constituents, so such as bile acids, amino acids, glucose, ammonia, and medium length fatty acids, and intestinal antigen. So amino acids, glucose, and ammonia, and the fatty acids, actually they are coming from the ingestion. They are coming from the digestion and taken up by GI tract. So after the digestion process, they can digest the food into this macromolecules. So that's the so-called nutrients we whole body needs. And another one is bile acids, and bile acids will be released from the gallbladder and released into the GI tract, and then they will be taken back into the liver. So it will be appear in the portal vein, in the portal blood. And there is some pathogens or so-called intestinal antigens. They were also in the portal blood. So this substance, when they enter in the blood, when they enter liver, and they will be all to be absorbed, or to be pathogen will be removed by liver, and the clean the and yeah, not so-called clean. So these macromolecules or this including bile acids, they will be taken up by the liver, and the rest of the blood will reach to the systemic circulation. But in acquired or congenital PSS cases, this constituents in the portal blood, they cannot be well absorbed or processed by liver. So in this case, you can find that within this systemic circulation blood, you can find the increase of bile acids or ammonia. Okay, so since we understand that the portal vein, they harvest so much nutrients, and as well as they harvest some growth hormone from pancreas. So if this blood cannot properly enter liver, and the growth hormone for this hepatocyte cannot be well distribute to the hepatocytes. So finally, it may result in hepatic atrophy. So this is the histology view that we about liver liver. So in the liver, the smaller unit is this. Is this what's so-called liver lobule. So it's liver lobule, and we can find in the central is what we call the branch of hepatic vein, and outside there are three kinds of ductal system, and the red one is the branch of hepatic artery, and the blue one is branch of portal vein, as well as there's another system we just mentioned about. This is the branch of bile duct, or so-called bile ductures. So if we connect two hepatic artery branch and the two hepatic vein branch, we can create an area, and we can divide the area into three parts, the so-called 1, 2, and 3. So this three area actually they possess different functions of the liver. So this is the basic unit that so-called liver lobule or hepatic acinus. So outside of the hepatic acinus, we can see the branch of portal vein and the hepatic artery. So this is what we call the functional area, not just the functional area. So we can divide the functional area into 1, 2, 3, and through the blood vessel distribution, we understand. I think it is easy to understand that in zone 1, in area 1, or so-called zone 1, they can take up most rich nutrients as well as oxygen. And in zone 3, actually, because they are very near to the branch of hepatic vein, so in this area they cannot take so much oxygen or nutrients comparing to zone 1. So I just mentioned that in different zones they have different kind of functions. So in zone 1 we can see the hepatocytes in zone 1 basically, and they are responsible for albumin synthesis, gluconeogenesis, cholesterol synthesis, amino acid metabolism, and urea formation, oxidative energy metabolism, and removal of bile duct from the portal blood. That's so-called bile acid circulation. That just as I said, that the bile synthesis by hepatocyte and then released into the GI tract, while during the then they will be taken up again by the hepatocyte. And this function is actually is prosecuted by zone 1, but by the hepatocyte in zone 1. So we can understand that basically in zone 1, they responsible for most of the part for the nutrients and uptake and the nutrient metabolism, such as amino acid metabolism and cholesterol synthesis. The cholesterol synthesis is due to they use the lipids digest and result from the GI tract. So we have the triglycerol, and they can use this lipid digestion, this triglycerol, and to synthesize cholesterol. And they're also responsible for gluconeogenesis. So actually, liver is a very important organ for balanced blood glucose. So this part is gluconeogenesis, while hepatocytes also are important cells for the glucagon storage. So for the blood, for the balance of glucose within blood, liver also played a very important role. And for the oxygen energy metabolism, yeah, it's a kind of it's zone 1. Yeah. So zone 2 is a little bit in the twilight zone. So we won't put much focus on zone 2. We put focus on zone 3, this area. In zone 3, we can find the hepatocyte in zone 3. They are responsible for liponeogenesis. So it's basically they will maintain the lipid balance within the animals or humans, and also they will responsible for formation of ketones and glycolysis and glycogen synthesis. So this part in zone 3, hepatocyte in zone 1, they are responsible for gluconeogenesis, while in zone 3, these hepatocytes were responsible for glycolysis and glycogen synthesis or storage. And also some glutamine formation is amino acid, and xenobiotic metabolism, and this is responsible for all kind of many kind of toxic materials or the drug metabolism were responsible for and by zone 3 cells. So hepatocytes in zone 3 are most susceptible to hypoxic conditions because they are far away from the branch of the hepatic area, so they cannot take enough oxygen from the blood supply. So yeah, if some pathogenic condition occurs, most of the situation, we can find the necrosis or the apoptosis occurs in hepatocytes within zone 3. That's from the beginning. So we're talking about the parenchymal cell, and this basically hepatocytes. And hepatocytes, you can understand from the introduction that they're responsible for the key. Actually, they responsible for the key nutrient balance, that the energy we need to, all the macromolecules balance within our body. In animals and humans, they both do the same thing. And another function we just mentioned about liver is about the immunologic functions. So there are some kind of immune cells. So the major population is Kupffer cell. Kupffer cell actually is the macrophages. So they can filter bacterial and bacterial product endotoxin in the total circulation. So this is the first line of defense for our body, that for this, because this macrophages in liver, they can fight and they can uptake all these bacteria. So you can understand that liver can do metabolism for these macromolecules, as well as some of the vitamins. Yeah, they produce some key vitamins, such as vitamin A, and vitamin A is also produced by liver, and they can do immunological defense for us. And because they have the P450 system, then they can do some drug metabolism or toxic compound metabolism. So the so-called detoxification function. Okay, so that's the basic introduction of the liver. So so it is how can we diagnose the patient to confirm that this patient may have liver problems. So we have different we can start from the signalement, we can start from the age, because some cases such as a hepatitis virus, a virus trigger hepatitis, it may attack basically the younger or elder animals. And also there are some breeds such as Yorkshire Terrier and Irish Wolfhound, this kind of dogs. They are, because of the genetic problem, so they are has the high risk to suffer from portal-systemic shock. And also these dogs, these breeds listed here, because they are deficient in some kind of liver to deal with copper. So they are easy to suffer from copper toxicity. And so there's some kind of clinical signs. If we find this clinical signs, we may need to list liver disease in our differential diagnosis, such as icterus. We can see this you can see the mucosa, or you can see the skin, and they become yellow color, something. Yep, this is the typical symptom we can find when severe liver disease is found. Also, we can do some clinical examinations. So the common clinical signs were listed here. We can understand that. But basically, the animals will feel depressed. You can see they express depression, they express decreased appetite, and some GI problem may also occur. And you may also find that they have a gray alcoholic feces. And when the animal show the feces show gray color, that means their bile duct system actually is the problem is occurred in the bile duct system. So it's but if gray cysts is found, that actually the case is in which becomes severe situation. Although you can find the animal may show polydipsia or polyuria symptom because they are the major organ to maintain the glucose balance. So you may find that the animal express these typical symptoms a little bit like DM cases. So ascites, because if the severe liver, if the liver suffer, is going to the very severe situation, and they cannot produce albumin. And albumin is the major protein within blood to maintain the osmosis. So if the albumin cannot be synthesized from the liver, and there is not enough albumin within the blood, so they cannot hold the osmosis, and then the body fluid will move from the blood into our body cavity, so we can find the ascites. So icterus, the so-called, so the yellow skin, the yellow mucosa, And also, if you use some image tools such as ultrasound, they can find alter the liver size. Okay, such as cirrhosis, you can find the liver become smaller and irregular. Yeah, and bleeding tendency, because liver is the main organ to produce coagulation factors. So if the liver is under the very severe damaged situation, they cannot produce not only albumin, but also they cannot produce coagulation factors. So this animal, in this case, will become easy to, easy to be bleeding. So also some severe cases, you can find encephalopathy. So that means the animals, they will show some neurological symptoms. That's because the liver cannot function normally, so they cannot process ammonia, and the ammonia actually is highly toxic to our cell, especially our neurons. They are sensitive to this ammonia. So the animals may show some neurological symptoms. Okay, so just as I mentioned, if we found some liver problem, we need to rule out if this problem occurs primary or secondary to other diseases. So just as I mentioned, if this case has the cardiovascular problems, we may find the secondary hepatopathy, or in these cases, these presence will also result in secondary responses. So how to do diagnosis of liver disease, and we can follow the following, we can use the following tools. And the first one is basically most of the time we will just take blood and to measure the following enzymes or following materials. And the basic enzyme will be ALT, AST, and the ALKP, or some kind of so-called ALP. And in some area, or some just basic personal choices, in dogs and cats, you can also measure GGT, and GGT, and the meaning of GGT actually is similar to ALP. So ALT and AST actually is related to hepatocyte damage. This means hepatocyte damage. So if if something happens, something attack hepatocytes, because ALT and AST are within the plasma of hepatocytes, so this enzyme, this ALT, AST are both enzymes, and they're responsible for the to maintain the normal physiology of these hepatocytes. So if these cells are damaged, these enzymes will be released into the blood as well as within the body cavity. And another thing, for ALP and GGT or GGT, they are basically located on the cell membrane of bile duct, of the epithelial of bile duct. So if the pathogenic reason is from bile duct, biliary damage, you can find the elevation of ALP and the GGT, as well as another typical material is cholesterol, because actually the bile and the major component of bile is synthesis from cholesterol. So if bile system is unbalanced or damaged, the cholesterol, you can find the abnormal upregulate or down increase or decrease of cholesterol. So such as you may find that in severe hepatic failure or PSS, the cholesterol may be decreased. And you can also assess the hepatic function by bilirubin, by bile acid, and by clotting parameters, because they produce coagulation factors. So if in severe liver function abnormal cases, the patient may have the bleeding tendency, so can find the prolonged APTT or PT times. And for bilirubin and bile acids, now you can just use the equipment and in-house equipment to measure bilirubin, bile acid, as well as ALT, ST, and ALP. And also you can use imaging, just as I mentioned, you can use ultrasound, you can use radiography to help us outline the morphology of liver. So for this small size, maybe have the chronic liver failure, or they may suffer from cirrhosis. For the large liver size, they maybe suffer from acute inflammation because there are so many immune cells infiltrate into the liver, so it will increase the total volume of the liver. And also, if some neoplasia they are developed within the liver, you can also find the abnormal morphology of liver. And if the liver has the generalized enlargement, that means it becomes so big, generalized. Okay, so it may have some kind of diffuse infiltrative disease, such as infiltrated by fat thing. And for the focal enlargement, maybe this enlargement are result from cyst or results from the liver lobular neoplasia. So it's just as I said, it's a case of feline hepatic lipidosis. So you can see this case has the bigger liver compared to the normal cases. That's because they are many it's some fat. They are stored in the hepatocytes, within the hepatocytes. And also this is the Cushing syndrome. In one dog cases, you can find the generalized hepatomegaly under the X-ray. So you can see the this case. Yeah, they show the typical symptoms of Cushing syndrome. So if you try to, if you find the abnormal parameters we mentioned before, or you use ultrasound or X-ray, and you found the abnormal size, then you can also do some fine needle aspiration or liver biopsy to help us to get the real tissue and to do the more precise diagnosis. Okay, and this is another case, is a Q-phase protein. We just mentioned about albumin, we mentioned about the coagulation factor, and actually a Q-phase protein, it is also produced by liver. So if we found the reduced Q-phase protein, such as alpha-1 globulin, then it may indicate that the liver are suffered from some severe damage. And actually, there will be the decrease of albumin, coagulation factor, and Q-phase protein. If we found the decrease of these three kinds of protein in the blood, actually it indicate in most of cases indicates that over 60% of the liver parenchyma actually is damaged or affected. So this is what we call. So I will just pass this, and they just this picture just let us to understand that's how this enzyme located. And I just mentioned that we can use some in the on-bench or in-house equipment, and can help us to do some blood chemistry analysis or coagulation evaluation, situation evaluation. Okay, so we can also to understand the bilirubin. We can also analyze the bilirubin, the cholesterol, the bile acids. Okay. So for ALT and ST, we just mentioned is related to the hepatocellular damage. Okay. but we need to focus on, we need to realize there is some limitation of this, parameters. For ALT, increased ALT activity actually related to hepatocellular injury or necrosis in both dogs and cats. And however, though liver is the major hepatocytes, the major source to produce ALT, there is another source, that's muscle. So muscle necrosis will also result in the escalation of ALT. Okay, so this for dogs and cats. But if the case you measure is horse, ruminants, pigs, or birds, actually we cannot use the ALT because they have a few ALT within their hepatocytes. So it is the specific. It is the we have the species. We have to notice about these species. And AST, yes, they show the something related to the hepatocyte damage, but just a little bit similar to ALT as muscle cells. They also has AST, and they has higher level of AST. So we can see this point that if ALT is significant in dogs and cats, if ALT is significant higher than AST, it indicates a hepatic injury. However, if only AST is elevated and we cannot see any ALT changes, it may indicate skeletal muscle injury. So basically, we will do both ALT and AST, and in liver cases, if the liver damage occurs, ALT and AST will both be increased. In horse and cattle, since I just mentioned, they have few ALT in hepatocytes, so they can use only AST to help them to find if some liver damage occurs. But you need to take care about the other factors affected AST concentration in blood, such as muscle damage, hemolysis, something. Okay, so this is ALT and AST. And for the ALP or GGT, we just mentioned about it, it's the indicator about the, actually it's the indicator for bile duct damage. So it's a good indicator for, especially for cholestasis. That means the bile duct actually, the bile, they cannot smoothly to go into the, to be transported into the gallbladder because the bile duct may be obstructed. So all these bile are stay within the liver, and actually this stay in the it's a problem, some kind of disinfection activity, and by destroy the lipid bilayer. So when they stay within the liver, this bile will also damage hepatocytes. So that's why I'm talking about hepatocyte and bile duct system. They will influence it. They are neighbors, so they will influence each other. So if cholestasis happens, the bile are stay in the liver, they cannot go into the gallbladders, and so finally they will destroy or damage hepatocyte. Okay, so this ALP. So ALP elevation, escalation, actually it's the indicator about the bile duct problem. While we need to take care, there are still some factors they will cause the increase of ALP, such as hyperadrenal corticism, or this case, they are firstly, they have the treatment history. This case, if they are treated or they are exposed to corticosteroids, it will cause a giant escalation of ALP. So if we find the ALP is a significant increase within the blood, yes, that may be a good indicator for bile duct problem, but we need to look back about the whole history of this case. If they suffer from different, and if they suffer from, such as I mentioned, hypergenocorticism, or they are exposed to corticosteroid, these two cases just because the ALP are very sensitive to glucocorticoid. If glucocorticoid is treated in dogs, they will hugely increase ALP. However, this case won't happen in cats. So yes, ALP has so many influence in so many factors that will to interfere our judgment. So you can also use GGT. GGT actually is yes, it's just like ALP, it locate on the bile duct epithelium. So if bile duct damage occurs, yes, GGT will also elevate it. So there's another thing I need to I think it's GGT, the common usage the common application about GGT is the measurement of GGT in urine, because GGT located on the bile duct epithelium, and not only, but also they located on the kidney. So, and if we found the elevated GGT in urine, especially we commonly see that if this animal is treated by aminoglycoside antibiotics, and it may have some nephrotoxicity, and then we can find the GGT increase in urine. So this is the common enzymes we used for the hepatocyte and the bile duct analysis. So I think this is a very good figure for us to use these free enzymes to help us diagnose the different situation of liver problem. For this case, this is typical profiles of liver suffering from acute injury, because we can see the higher and very rapid responses of AST and ALT. A rapid increase of ALT and AST is shown in these cases, while their ALP is slowly and not so high concentration within the blood. So it means there is a condition happens to the hepatocytes, major the parenchymal cells, not the bile duct system. And for this case, you can see the bile acids. That's the major components of the bile. So we can see the bile acids, they increased very quickly, while the ALT and the AST, yes, they sometimes increase, sometimes decrease, sometimes increase or decrease. So they don't have the very acute and the giant jump of these two kinds of enzymes. So this is the actually you can understand that if the this is the case that yes, ALT become and AST become high and they decrease, increase and decrease. That means there is something always and chronic, this chronic injury or persistent injury of the parenchyma. And at the end, You can see this is the late stage. At the end, it's not only influence the parenchyma, but also they affect bile duct system. So finally, we can find at the beginning bile duct acid is normal, and then it become higher and higher. So it's a typical case that the parenchyma problem finally affected the bile duct system. And at the end, this is the later stage, but at the end, we can find that there is no more increase of ALT and AST. And this is not a good news, since it means at this very late stage, there is few intact parenchymal cell or intact hepatocytes exist in this case. So actually, this is common. This is a common profile as we can see for the severe fibrosis patient or cirrhosis patients. So for cholestasis, that what we said, as the bile is accumulated within the liver, we can see, okay, ALP actually is the major enzyme that with the highest concentration. However, if this bile still OS, or they cannot exit out of the liver, then they will gradually affect our parenchymal cells. So you can see the slow but still increase of ALT and AST. This is the cholestasis situation. Yes, due to the time limit, so I think I just use this kind of enzyme to help us simply differentiate what part of the liver going wrong. So yeah. So I think there is still more we need to take care for addressing the liver problems. But due to the time limits, I think I will leave the slides yeah, I will leave the slide, and if you have any question, you can contact me through the email. Okay, so I'm happy to take questions, and actually there are some questions in the QA windows. So most of the okay, the slide will be, I think the slide will be sent to you soon. Okay. So there is a question talking about why the copper toxicity is in breeds like Ballington Terrier. This because just as I mentioned that different breed of dogs, they have actually the copper they need to metabolize by some specific enzyme, but in some breeds like Ballington Terrier, they are for the genetic reasons, they are deficient of such kind of enzyme, and they are not good at doing copper metabolism. So there will be a lot of copper accumulate, especially within the liver. So then they will cause liver at the beginning liver damage, and then the problem in other organs. Okay. So there's another question is about should we be worried if the liver enzymes results are below the normal range? Yes, it's a very good question, I think, but so I think it depends. I think this liver enzyme, they are important to help us to address the problem happens. But you have the patient history, you have the different kind of examination. So I think, I think this case, if if they are, and if you follow up this case for a long time, I mean, you will to do routine test in your clinic, so you can understand the whole history of this case. So if this case from the very beginning, their liver enzyme is normal but a little bit under the normal range, I think it will be okay. But if the liver enzyme ever increased very high and then gradually it becomes so very, very, very low and then below the normal range, just less. So that is the situation I mentioned, that the parenchyma, over 70% of the parenchyma cells actually is damaged. And at this situation, actually, you can very easily find it, because in this situation, it's not only this liver enzyme you cannot detect them anymore. Actually, you can find a very high concentration of bile acid, very high concentration of bilirubin, and very high and the abnormal changes of cholesterol, and as well as ammonia will also be highly increased. So at that time, actually, that means the liver is just shut down. So every kind of symptoms you will find very easy. So if nothing happens, just liver enzymes, a case with the liver enzyme a little bit lower than the normal range, I think it will be okay. Yes. Okay, so yeah, I think every time when we talk about some disease, we always care. Yes, diagnosis is important. So how about the treatment? Yes, but since liver problem, actually we have different kinds of liver problems. So it depends on what kind of the situation we have. But for example, if the cases suffer from cholestasis, that means the bile accumulated, abnormally accumulated within the liver. Yes, we can use some kind of drug, such as I think, let me check it. Is this drug is used in both human and animals. The so-called ursodiol, ursodiol. This kind of drug is used in both human and animals, and they can, in mild cholestasis cases, it can facilitate the bile. They can push them into the gallbladder and go to the GI tract, and to maintain the intact bile circulation. But it only in mild case. In severe case, I think we may need surgery to find what kind of reason to result in the obstruction of the bile duct system, and they cannot, to make this bile cannot efficiently to go into the gallbladder. So when this severe case, surgery is needed. Okay. Okay, another card. Okay. Let me write. I think I can type the drug. I just say. I just talked about the ursodiol for cholestasis treatment. Yeah, this for the mild cholestasis treatment. We can use ursodiol. Yes, since right now most of the cases, most of the treatment for liver disease, we can use some herbal drugs, some support, so-called supportive treatment. Yeah, I think it is the way that we need to do to help them, maybe to wash out or to wash out the possible toxicity, or to wash out the such as ammonia something, and it is supportive therapy. But I think we need to find some new drugs and our new such as herbal drugs. It means the extract of herbal and extract from some herbal, some plants or some herbs. So it will be some kind of this therapy is actually, they are under development, and we will see some effective herbal drugs. Actually, they are good to reverse some bad situation of liver problems. So it may be one of the potential choices for liver disease treatments. On the slide, you have gallbladder percentage of problem in gallbladder can be percentage the problem in gallbladder can be detected. And other question, there is a question mentioned about the gallbladder problem, and I'm not sure what percentage that problem in gallbladder can be detected. Actually, I cannot really I cannot know the exact percentage, but if already found the problem within ultrasound, and then you can also try to measure ALP or GGT. I think you can find some difference, especially increase of this kind of enzyme, and you will find the elevation of bilirubin, elevation of bile acids. It will help you to confirm the problem of bile duct or gallbladder problem. Okay. So thank you for all the questions. I think it's also, it's all very good questions. So I'm look forward to seeing all of you in the future. Thank you.
Hi everyone. If you need a PPT, the PDF file of the PPT, please leave your name and email on the Q&A. We'll send it to you later. And thank you for Dr. Lin's excellent presentation. We'll see you next time. And good night, everyone.
See you, and thank you, Dr. Lo. Thank you. See you.
Thank you.